Hello, everyone, and welcome to the Private Practice Show. Tonight, we're going to be joined by Alex Wynter, who's going to be sharing her story about how she's transitioned from being in home care, being a home care based SLP, to being able to be in full time private practice. Can you all let me know in the chat if you can hear me and see me? That would be super helpful, especially if you can hear me, because I'm trying this microphone tonight. Can you all hear me? Let me know in the chat. Okay, people aren't saying anything, so I'm wondering if y'all can hear me. Yes, you can hear me. Okay, great. Thank you so much. Okay, great. So I'm going to bring Alex on. Actually, I'm going to bring Alex on in 1 second. I want to let everyone know that we are doing our upcoming private practice boot camp that starts in 2 weeks. So if any of you watching are interested in doing private practice but haven't gotten started yet, boot camp is an awesome opportunity to start getting your ducks in a row and to get set up and ready for summer. So just comment bootcamp 2024 in here and we'll send you the link via DM. So I just wanted to make sure everyone knows that you're invited to our private practice bootcamp event. So let me bring on Alex. Second, and y'all will hear her awesome story of transitioning from home health to private practice. Hey Alex, how's it going?
Hello, doing good. How are you, Jenna?
I'm fantastic. I am so excited to have you on. Some of you may know I've known Alex, we've known each other for what, like 2 years now?
Yeah, it's been a while. Definitely at least 2 years for sure.
At least 2 years. Yeah. So one of the things that is so cool is I've been able to watch you from like just starting your private practice and kind of just thinking about it to a
Mhm.
pretty big change that's coming up in your life, which I'll let you share in here in just a second. But can you tell our listeners and viewers who maybe didn't get to hear you on the podcast a while back a little bit about yourself?
Yes, hello everyone. My name is Alex. I am a speech language pathologist, medical speech pathologist, and home health practitioner and private practice owner. I am based out of Philly, and I started my practice 2 years ago, kind of in a very hectic time, coming right off of COVID and the pandemic, being denied all of my summer PTO. And I remember I was on my way to a wedding, seeing Jenna's emails in my inbox and being like, you know what, I think this is the time to do it. And that's when I started my practice. But I was also in the thick of planning a wedding. And as you know, also helping caregive for my father. So again, that first year was really not a lot. It was planting the seeds, I would say, because that was a big step for me. It was something that I was thinking of. And the combination of everything happening, COVID, pandemic, dad's hospitalization, wedding, and vacations. I was like, I just need to do it. So it's here. It's waiting for me when I have the time to actually dive deep into it. And so last year, I actually started networking and really diving into your course. And really, I would say, I guess, seeing those seeds start growing. And here we are today that they're blooming. So it's definitely been a journey.
Yeah, and you know what? For a lot of people, it is a journey, right? Like it's not always like, where you join the course, you start that weekend and then you're off to the races.
Right.
Like for some people, it's like that. But there are so many people who decide to start a private practice. And actually, tons of people have told me exactly what you said. Like, Jenna, I had a bad day at work. I had a bad situation going on. I got an email from you. I signed up for your course because I just wanted out of a bad situation. And
Mm-hmm.
so, but then the cool thing is that you're able to revisit the program whenever you need to,
Oh
right?
my gosh, it's my favorite thing. Like even today, I asked a question in there, and it's like even though you're not maybe going through a course or a module at that time, or maybe you had to press pause on your practice because life started to life, and you just had to pump the brakes, and you can always come back to that group and the mentors, and it's always wonderful knowing that you have that in your back pocket as a practitioner.
Yeah. Now, one of the things that I really like about you is that you're an adult person,
Yes.
right? You work with adults, right? And I think a lot of people have this idea that private practice is like only for pediatrics focused people, and it's not. There's a lot of adults who need, SLP services, need OT services, and because there are less private practices, it's actually a bigger opportunity for the people who do pursue private
Hmm.
practice. So can you tell people a little bit about like what it's been like for you to kind of have a more adult focused private practice?
Sure. So to preface this, I have only ever worked with adults. I dipped my toes in the peds world because I had to for my grad school externship. So I really do not have any knowledge right now, clinical knowledge of working with pediatrics. So my whole experience, my entire world is adults. So obviously I knew leaning into my practice that that was something that when I was doing market research that I was not seeing in my area at all. Like, yes, there are private practices, but most of them serve adults and seniors. And while I think that's great, right? People have different skills and they have different strengths that they pull on for their practice. For myself, I was like, wow, this is going to be a really great thing for me to stand out and something that I can really hone in on when I'm networking with other practitioners to say, hey, I am the only provider in the area that is solely focusing on the adult and senior population. So I have the time and the expertise to dedicate to the complex needs of the specific patients that you're seeing. And obviously it was scary in the beginning because when you are doing your market research, you're like, wow, okay, I'm the only one, I'm not seeing anyone else working with adults here. Like, is that a red flag? But you have to have a mission, you have to have values behind your business and know who you're serving. And I had still have such a clear idea of the person in Philadelphia, the type of client in Philadelphia that I wanted to work with. And I knew they were there, and I knew it was just going to take some time. I think that's the one thing too, as SLPs, we can tend to be type A sometimes. Yes, I said it, right? So we want things to happen. It's like, I've been a speech therapist for 11 years and I started a practice. What do you mean these patients aren't lining up to see me? Like, this should just be happening, right? And it's like, no, you have to let doctors know that you're there, and you have to let them know more than once. And you have to talk with other, PTs and OTs in your area. And guess what? You're going to have to talk to them more than once, more than twice, more than 3 times. And I think that's where it can feel like you're walking through the mud, and it is difficult. But I think in the grand scheme of things, when you're thinking, I'm establishing a whole brand new healthcare facility or, practice in this city, that's huge and that takes work. And so I'm happy to say, like, I have seen, those adult clients coming in. And it's been really nice. And that's one of the things that they always say to me is, we couldn't find anyone else who worked only with adults, or we found you because you work with adults only.
Totally. Because people want to go to people who like can very solidly help them,
Right.
right? Like if you have, a spouse, you have a parent, you have someone, like could you go to a peds practice that like also sees adults?
Sure.
Sure, right? But like, would you want to find a practice that solely focuses on adults? Yeah.
Hmm.
Like that's what you're really going to be looking for, right? And it's true, there are less adult practices, and the reason why, everyone, is because there's just less adults who need speech therapy services than kids, right?
Right.
Just diagnosis wise and everything else, it's less people. However, for those people who do start adult practices, they have an awesome opportunity to be a big fish in a small pond. And what Alex was saying about having to like go to or not pediatricians, like physicians, right? Also
Hmm.
like physiatrists, any kind of specialists, you know, um, I don't know, whatever, anyone who works with adults too, right?
Hmm.
Like neuropsychologists, right? Or like geriatric
Yep.
caseworkers, all,
Yep.
geriatric social workers, right?
Yep.
And so getting your name out with those people so that you become the one that people refer to, right? They've got a patient comes in who needs X, Y, and Z, and they're like, no, Alex, you got to go see Alex. She's the one who can help you out.
Hmm. Yeah. And I will say that's kind of where I'm just finding myself. Our referrals are now either coming from the insurance company, which is like amazing, or they're coming from, physical therapists that I have initially worked with before and had a great experience with one or two clients, and then they have started referring patients to me. So that's been really wonderful. And asking for reviews, ask for reviews. That's been really great too.
Yes. Totally. And because again, and it's so funny. So many people that I work with are like, "Oh, I'm so scared to ask for reviews," or like, "What if they say no? What if they forget or whatever?" It's like if you have helped them, if you have helped
Yeah,
their child, their spouse, their parent, or whatever, they are so grateful, right? And like
yeah.
they would give you the world for helping their family member, right? And
Hmm.
like, tell people too. I was on a call earlier with one of our growers, and I was like, "Listen, tell this holiday season, tell your people, do not give me Starbucks gift cards, give me like a Google review,
Yeah.
right? That is infinitely more helpful to a small business owner. Like everyone loves Starbucks gift cards, sure, right? But what they really want are things like Google reviews.
Yeah. And I feel like one way to kind of um, like make asking for reviews a little bit easier if you're shy about it. My love language is words of affirmation. So like, tell me all day, please. Like, I'm gonna ask you. I'm really excited about it. But if you're a little bit shy, I would like just incorporate that into every single session. I always begin and end my session with, how are you? What did you really like from last week? What did you hate? What do you want to move forward with? What progress have you seen? What do you want to do next? So getting them in the habit of talking about their progress and talking about how you're helping them from day one. By the time you discharge them, it's going to be like, hey, remember every day or, every week for the past X amount of months, you've been chatting about all your progress. Can you just type that up in a Google review for me? Right? Like it's going to be so much easier.
Yeah, totally, totally. I have a question, and people who are watching, like if you have questions, go ahead and
Yes.
throw them in the chat. But one of my questions is, because again, I've heard this from a couple different people, but I would love to hear your perspective. You worked in home health, right? You
Mm-hmm.
could have stayed in home health. There's lots of people who do home health and stay in home health, or maybe they then do it inpatient or acute or whatever. But what made you decide to pursue private practice as someone who was doing home health?
So home health was, I will say, like the last setting on my stop of trying to find what I want to do as a speech therapist. And once I found it, I was like, this is it. I absolutely love the setting. I love the type of clients I was seeing. I love the type of therapy that I was able to do. But I wasn't loving the bigger structures that were telling me how to do that therapy or telling me how many patients I needed to see or manage or all the extra, CMS, Medicare guidelines that come through that you really have no say. Like if you're in corporate healthcare, you kind of just have to get in line, And for myself, doing that for, I guess, up to 9, 10 years at the time of deciding to start my practice, I was like, this something has got to give. I was just feeling like a constant like push and pull. Um, and especially as someone who also likes to use social media as further spreading the mission of what I do and educating others on speech pathology, depending on where you work, that can also be difficult. And so for myself, I was also kind of coming up into some friction with that as well. And so when you're on one side, it's like you're living two lives, right? Like you're doing all the things you love, but then it's like you kind of have to face the music the next day and like what may or may not happen. For me, it was just becoming like a really stressful way of living. So I knew, hey, Alex, you can still see patients at home. You can do this community care, but you can do it on your own terms. And you can feel a lot better about the rates that you're setting and how many patients you're allowing yourself to see and what your documentation looks like, and all of those processes can totally change. So that was really, and also PTO, that's also a driving force, not having to ask for permission to take a day off.
Well, because that's the thing. A lot of hospital jobs say, oh, we have really good benefits, right? We have really good, healthcare. We have really good vacation time. But like what they don't tell you is that they basically never let you take it.
Right. Yeah.
Right? It's like the biggest scam. I remember that was true for me in the hospital too. And, I don't know, it's just terrible, right? So yeah, so really what you're describing is being able to have like the flexibility for your
Hmm.
schedule, right?
Yeah.
But also like the fulfillment and also the freedom to say, like, I want to treat these clients or, you know, patients the way that they need to be treated, right? Like I want to be
Hmm.
able in grad school, we are taught that like we're the boss basically, and like whatever we
Yep.
think that the patient needs, that is what we deliver. And it's a pretty rude awakening to get out there in the
Hmm.
profession and have people be like, oh, you want to do LSVT with a client 4 times a week? You can't do 4 times a week here,
Right.
1 time a week. And you're like, but that's not how it, right?
Exactly. Yep. That's exactly it.
It's terrible. It's terrible. Okay. I remember like back in when you were on the podcast before and a couple other things, I remember hearing about the vision for your private practice and that you wanted
Yes.
to have like a real well, can you just share for everyone and maybe your vision's changed. I don't know. But tell people, what is your private practice looking like and what do you want it to look like?
So my vision when I started was that I never wanted, and I hate starting with never, but it's good to know what you don't want. I never wanted to be 100%
Yeah.
clinical. I love what I do, but doing it for so long, I knew that there were so many other skills that I have gained over the last decade that I could better serve or more uniquely serve the same type of patient population. So, what that has looked like for myself the last 2 years is one, obviously seeking connections where I can get referrals for speech therapy, but then also looking for other opportunities, again, where I can use those non clinical skills to still bring in income. So, that's looked like public speaking, it has looked like paid consultations, mentorship, caregiver coaching, and most recently, it has looked like a new, which this has always been a dream of mine, so I'm really excited about it, is a remote position that is going to allow me the opportunity to create educational resources for patients and caregivers, and then host webinars and support groups for patients and caregivers. So if you know me, you know that is like right up my alley and everything I have already been doing. So to be able to add that, like I said, kind of into the wheelhouse of the Wynter Wellness Group and my practice and kind of the world of Alex as a speech therapist, I'm really excited for that, you know. And I think also just kind of a note for all of you people who are listening and growing your practice, like that's just my personal journey, and that's what I wanted my private practice journey to look like. You know, I wanted to have clinical my practice, and then I wanted to have something non-clinical where I could work on, you know, and use other skills. But you know, if you're in Jena's Facebook group, as you know, there's so many clinicians out there too who are 100% clinical and absolutely love it. So I think it also comes again with just like really having a strong foundation and knowing what you want out of your practice, knowing yourself and how you want to grow. But like you said, sometimes the vision can change, and that's totally okay.
Yeah, totally. And I love that you're, again, you're now pursuing the kind of things that you like always wanted to do,
Hmm.
or that somewhere along the way you realized that there was a gap, right? That it was like, okay, here's
Right.
something that like people really need that they're not getting, but I could actually deliver and I would be really happy to do that, right? So when people hear me talk about like private practice as a little bit like a choose your own adventure
Hmm.
situation, like this is what I'm talking about, that you don't have to have like your private practice doesn't have to be just one way.
Hmm.
It doesn't have to be like, you know, air quotes everyone else's or whatever. It can be whatever you make it, and there's so much freedom in that.
Yeah, there is. It can, but that can be scary too, because it's like the world is your oyster. But having, you know, a mentor like you and the group that you offer, you know, definitely helps provide more direction for people, and talking to people in the same boat as you and seeing like, well, what are my options? Because I think one thing about our field is we aren't taught all those options in grad school, you know, and it really is, like you said, a choose your own adventure. It's like, you know, trial and error as you're just deciding to do different things in your life and figure out what you like, what you don't. And at some point you hope it all matches up to give you a job or business or a combination of whatever that might look like for you, that that feels good. So, I'm 35 and just now like I've figured all that out. So I think, you're fine. There's no age to make it happen.
Yeah, totally. And I love, again, I just love people creating something that works for them. Because I know that what's happening a lot right now, whether people are in schools or hospitals or home health, early intervention, or whatever, is people are just feeling really stuck. And
Mm,
people are feeling like they're not able to make the decisions that work best for them, their clients or themselves. Right? People are feeling like they don't have that flexibility, of the schedule. Like right now, school SLPs, for example, a lot of people are looking forward to summer, right, which is great, but a lot of people work during the summer. So, like, even though people think that that's like a more flexible thing, like, it's not necessarily if you're
right.
still having like to do these other things, right? So something that I've just always really liked about you and appreciated about you is that like you are creating opportunities for the patients that you see, but you're also creating opportunities for yourself to get that fulfillment, but also the financial piece of being able to earn more money while helping more people.
Yeah, for sure. And also to kind of like harp on this journey looking different for everyone, like I was working my full-time job, everyone, like up until literally a week ago. So like I was still doing both, and I really had no immediate plans of quitting because it didn't financially make sense for me. Like I still had student loans and a mortgage and a car payment and like all of these things. So for me, I knew that I was going to be growing my practice and working full time at the same time. So I think when you know that, you also are you're shifting your mindset into like I can take on a little bit more now, knowing later things are going to look a little different. So really, just to say again, you can craft what you want, and it's okay if that takes time. Like it's really okay if it takes time. Like coming from someone who, like I said, if if on paper it looks like I started my practice at the worst possible time like of my life. And here we are. And so if you're someone like me, if you're a caregiver or getting married or have family, children, whatever, life happens, and it's still possible. It's just going to look different for you and on your own time schedule, which is like, I keep saying it because it's something I have to
Yeah.
tell myself every day. You have, especially if you're going to be in a group with other people, you never want to compare yourself to where someone is. Everyone's resources is different, their time is different, their energy, like, you don't know. Jena could be someone who's hyped up on caffeine all day. You don't know. She's looking very calm right now, but she can be crazy caffeinated. So you never want to compare yourself to someone, right, or myself, because you never know what they're going through. But to still have that mission and have a why and have an idea of what you want your practice to be like you're on the right track.
Yeah. Totally. Yes. And thank you for mentioning like that kind of comparison to other people because, everyone's private practices look different. Everyone's private practice journey is different. And just like you
Hmm.
said, people are, have different, life situations and stuff going on that makes it that some people can like go all in and other people have to go a little bit more slowly, right?
Yeah.
Can you tell our listeners a little bit about your decision to leave your job? And like how did you come to that conclusion and how does that act like how did it actually look like to be like, you know what? I really am going to leave my home health job and fully transition into my private practice.
I think like for a year, I knew that I wanted to leave. I just didn't know when. And then the like productivity and caseload management and everything, just I was starting to feel like burned out, like feeling like I was not wanting to do my documentation. I was not wanting to go to work in the morning. I was not, like, and that is not me. Like I truly do love what I do, but I was like just feeling like, oh, like the wind was being sucked out of me. So I knew I had to do something, but I knew my practice wasn't in a place where I could just jump into that full time. And as someone who's still like financially contributing to my household and other things, like I had to wait. So to me, I'm like, okay, what's the quickest way out? I'm going to look for other PRN positions. I'm going to look for, you know, maybe brand partnerships. I'm going to look for like these other ways that I can use my skills, but maybe in like non-clinical ways, more flexible remote positions, things like that. So that's where I stumbled upon this new remote position that would allow me, like I said, to do all the things that I love doing already so much, and then applied for other PRN positions because, you know, practice can still, my own practice, the caseload can ebb and flow. And so I still wanted some sort of like tether to a stream of clients if I need it. And so once I, you know, heard back from that other remote position, I put in my 2 weeks at my full-time job, which was last Monday. So my last day will be Friday. And yeah, I am just like very, very excited. I already feel a weight lifted from my shoulders. But I can tell you, if things stay like, if that job stayed as what it was when I started, which was very, I would say, easier, and there wasn't a lot of stress, there was a possibility that I could have grown both, you know, side by side and had a double income. But one was outweighing the other, you know, and that's another thing of just like being aware of your situation, your own limits, where you see yourself growing. So yeah, I put in my 2 weeks notice. I was very nervous and practiced like the whole morning of what I was gonna say, and like I had the script on my personal phone while I was on my work phone, and I was like trying to read it so it would come out. I was so nervous, but it went fine.
Yeah. I love that story, right? Because I really just, again, I want people to feel comfortable leaving their jobs. And so one
Yes.
of the things that a lot of people do is, and, you know, people, you know, listening and watching, like you can do this a couple different ways, but it really kind of comes down to math, right? So it's like either you can stack a ton of patients like on the side of your job, see like clients, you know, as much as you can during the week so that you build that private caseload so that when you then leave your job, you then shift all those people like into the daytime or whatever. And
Mm-hmm.
there's that part of the transition. The other thing that people do is really just what Alex said. It's like piecing together like maybe a part-time job, maybe some PRN positions, you know, this kind of thing. Maybe covering a small time like a school contract, maybe covering like a maternity leave or something like that, so that
Mm-hmm.
you do have some regular income, but at the same time, that income is a little bit more flexible. Like you're not locked into
Right.
something in the same way that you kind of are before. And then you just start growing your practice. And then, you know, again, hopefully that really takes off. But in the meantime, you've got this really nice cushion of other financial opportunities that then you let go of those things one by one as the practice grows.
Yeah. I'm so glad we're talking about this like out loud and being transparent, because I think it's so easy, especially on social media, and even if you're scrolling your Facebook group and you're not like actively like digging in there and getting to know people and where they are, it's so easy to just look at someone and be like, oh my gosh, well they just quit their job and they've been in their practice full time, like, and it was like nothing for them, you know, or like to see other accounts and just like, oh my gosh, they're so successful, like they're full time, you know. It's just like unless you've talked to that person and you like truly know their finances and know their journey, it's, you're doing your a disservice just comparing yourself to someone else's journey, because you just have no idea. And you can make your, we keep saying it, but you really can make your practice journey look however you want it to in the time frame that you want it to. It just has to make sense for you. And I remember that's the conversation I was having with a lot of my friends as I was, you know, making this decision. And I'm so, also get yourself good friends in business. And a lot of them said, you know, don't quit yet. Like the money has to make sense, Alex. Like we know you're itching to quit. You know, if you can hold on a bit, like just make sure you're covered. And as difficult as that was, they were right. So, you know, definitely make sure the numbers are making sense for you. Even if you have to quit and like work somewhere, like just work somewhere else for the meantime, like if it's that, if the environment is that toxic and you like need to get out immediately. But it's totally okay to piecemeal your clinical life, and I think you should, because we're not taught that. And I'm sure from grad school to where you are now, you've learned so many things about yourself and added to your clinical toolbox. So for me, I'm just so excited like to see where I started, literally from grad school to now as a completely different clinician. And so I'm excited for this like new chapter at 35 and, new type of speech therapist.
Yeah, totally. And one more thing, I just want to go back to something you said earlier, which had to do with the burnout, right? Was
Yeah.
like feeling like completely burned out. And I say this all the time, but burnout is the number one threat to each of us being able to stay in this profession, right?
Yes.
And we're helping people like we love this. We chose this job for a reason. We chose this profession. I think most people really love the field and love what we do, but oftentimes don't end up loving their jobs,
Hmm.
right? Or especially over time. Maybe it's okay at first, but then like over time, maybe your caseload gets bigger, maybe the productivity requirement
Right.
increases, maybe the documentation, all that kind of stuff. And you really have to make a decision that is all about self-preservation, right? Because if you burn out, you can't help people, and you've now kind of messed up your livelihood, right? Because like this is what you have a master's degree in. And so
Right.
I love that I don't love that you were having a bad situation at work, but I love that you put yourself first, right? Because we're so good at putting our clients and the everyone else first, our coworkers first, whatever, that
Hmm.
sometimes y'all we got to put ourselves first so that we can stay in this profession.
Yep. Oh, I had every excuse. No one knows this area as good as I do. I've been there the last 7 years. Who's gonna treat these patients? And my husband was like, "What are you talking about?" Enough is enough. Like he's like, "Sadly, you are replaceable." I'm sorry to tell you. And a little tough love. He's right. So, a little bit of tough love for us all out there. Like you said, self-preservation is key. And if you love what you do, you can't, so cliche, right? We can't pour from an empty cup, and so you really gotta take care of yourself.
That's right. And Alex, this is just tea. It is caffeinated to your
Yeah, I
your
told
point
you
earlier.
she's a caffeine queen. We knew
I do. I like my iced tea. I'm from the
it.
South. But
See?
anyway, but I just want to like again kind of like raise a little glass and a cheers to you to your last day
Oh,
of work
thank
and to,
you.
just going through this journey. And I'm just so excited for what's ahead for you and for your family, but also for these clients in your area who really need the services that you're getting ready to provide.
Thanks. Yeah, it's been really cool to like walk to some of my clients. I've just had this dream of being like a community therapist. Some people I feel like get really nervous, like, oh my gosh, what if I see my client out on the street, or what if I see him in the store? And like I love living and working in Philly, and like I love walking to see my clients. And so if I did see them, I would be super super excited about it. So it's been really cool. And I know I saw a question someone had asked about getting over the fear of billing and insurance and that whole thing. Just to quickly answer that, I did try to be private pay only, and that did not work. And if you are going to work with adults legally, you do have to accept Medicare if your patients are of Medicare age. So I did go the Medicare route, and then I did end up taking two other insurances. Cigna and Independence Blue Cross, which are big in this area. And that's been huge for me, people finding me from their insurance website. So that's been pretty cool. And yeah, I don't know how to give her the fear of it. I can't tell you that because I'm still fearful of it, but I just do it. So I would say you just got to do it. Take courses, if you're not in Jena's course already, like that's one thing I love is that there are mentors in there that I can ask about billing. And there's a whole course on it, but like do the work, like go to the Medicare website, go to the IBX website, like there are resources out there, make phone calls, you can figure it out. Or if you can, invest in someone to help you do it. There are billers out there as well.
Yeah, totally. It's a learning curve,
Yes.
right? It's a learning curve to like anything that you are learning, right? Like
Yeah.
think of grad school, right? I mean, I showed up, I was a psychology and sociology major in college. So I wasn't even like a common disorders person, right? I learned a lot in those 2 years, right?
Sure.
Like people can learn, we're smart people,
Yes.
right? SLPs and OTs are smart. You are capable of learning new things, right?
Hmm.
And like is insurance like the most exciting thing to learn? No, it's not. But like if your livelihood is dependent on it, like you're gonna learn how to
If
do it,
if
right?
you want to get paid, you're gonna learn the insurance. So it's not gonna be so scary anymore.
Yeah.
figure out where your money's coming from.
Exactly. Well, Alex, thank you so much for being on. Thank you for sharing your story. Thank you for sharing about your big transition from home health to private practice. Where can people learn more about you?
So you can follow me on my personal account. That's at alexandria.wynter. That's Winter with a Y. And then you can also follow along with my private practice on Instagram. That's at the Wynter Wellness Group, also Winter with a Y. Or you can go to the winterwellnessgroup.com.
I love it. I'm so proud of you. Another cheers and a toast to your last
Ah,
week in your
I'm
transition.
cheersing, high
In
fiving, dancing. Thank you so much.
I love it. Awesome. Well, thank you again. And thank you for everyone who was watching. I hope that this was helpful, that this was inspiring, and that like seeing like just another way that you can have another private practice, like helps you think about what you want your private practice to look like. So again, thank you, Alex, for being on.
Thank you so much, Jennifer, for having me. Bye.
All right. Bye, everybody.